Well, for me, it's the kind of compassion, empathy I get from my social workers and my psychiatrist. The psychiatrist I have finally got it right. I had 3 psychiatrists before in Mississauga, and all had misdiagnosed me. But this one here asked my past history, and she rightly concluded what my mental illness was.
We had to change all these psychiatrists, to find the right. And I found a woman psychiatrist, and we're very lucky that she talks to both of us. There were some psychiatrists who wouldn't talk to me. And I stress so much family inclusion, because we really are in the forefront of the work and the devotion for our loved ones. We cannot be excluded. It's very important that we are included. Just to make sure that I didn't get a psychiatrist that would not talk to me, I convinced my daughter in one of her better periods to sign that I would be the power of attorney.
Okay.
So this is secured, because I don't want to go again and something happens to my daughter that I have to stay out.
One of the things I wanted to talk about today that I did talk about was how important it is to be able to be part of your loved one's process when they're in crisis. The crisis time for your loved one is a very serious and severe challenge. And as we try to navigate through all the paperwork and get our loved ones the supports they need, usually you end up maybe in a hospital situation, let's just say, and you just want to hope that the hospital you're going to and the encounters that you have with the people at the hospital are all positive. You try to keep it as positive as possible with your loved one. And the power of attorney is something that I found to be very helpful for me. Just being able to have that piece of paper that says, look, I have the power of attorney over my loved one, and anything that you need to discuss with him, you can discuss with me, and anything that needs to be signed, I can give authorization for that. That to me is a tool that is very useful and helpful. So if you can get your hands on your loved one's power of attorney, papers signed by them, allowing you to have that power, that is very helpful. I found that to be helpful for me.
And the only reason that we have survived is because of the support we received early. One, seeing a psychiatrist. Secondly, meeting a family support group and meeting other parents who had years of experience of managing someone with a mental health diagnosis. That made such a big difference that I'm very committed to continuing to support the efforts of not only those who've been diagnosed, but their families who are coping. So I think within families we have issues. There are no perfect families, but certain behaviors exhibited may be related to mental health issues that have not been dealt with or diagnosed. So if we start early to address behaviors, then we may avoid some of the severe diagnosis that we see much later. And we could also be addressing, is a parent having an issue that's not being dealt with, that's affecting the family, and in the end, we know what happens. There's a huge price to pay in the long run. So early diagnosis or helping families to deal with their issues, I think will also help to prevent the severity that we experience much later.